So far we've talked about actually injecting, or either through injection or intravenous, or transdermal magnesium application. Talked about using it in the eyes. Oral. There are many oral magnesium products on the market. The first law of magnesium consumption through oral means is that it is a touch and go thing. Most of the pill forms of magnesium need hydrochloric acid to digest them, and some people just do not have sufficient levels of hydrochloric acid, and that's a problem. Also, when you take magnesium orally in high enough dosages, then we have the problem of loosening the intestines and creating diarrhea, which is really actually not a problem, because you clean out the intestines and then you can regulate the dose. It's a little similar to high doses of vitamin C. This is called the bowel tolerance dose, and it's good to get up to that dose, and then you can drop the dose down by 30 or 40% or 50%, and then you're having a good, comfortable oral dose. Liquid minerals, like taking magnesium oil, it's a little difficult on the taste. I like to mix it with grape juice. You just cannot, and Dr. Gary Gordon from California has remarked about this several times, oral methods just cannot compete with transdermal. If you cover the body every day with magnesium oil, in 2 or 3 months you can replete the cell levels. If you use oral methods, it probably takes up to a year to top off the oil, top off the magnesium levels. So I like to use a combination of methods and techniques. When there's very little available, I like to conserve and use it orally. My favorite, of course, is magnesium massage. I have actually nebulized magnesium into the lungs, which is really a transdermal application, and we'll talk about nebulization more with sodium bicarbonate and glutathione, which is my favorite things, medicinals to use for nebulization. Magnesium, though it takes months to bring levels back to 100%, magnesium is still fast-acting. When a doctor will use an emergency room and a person's having a heart attack, its effect is immediate. Whether we start with oral or transdermal or combine the two, though we're looking at treating for months and actually permanently, meaning people will always be served by increasing their magnesium levels, that in the first few days, people are going to actually feel better. I remember, for instance, a patient of my wife had Parkinson's disease, and she came into the office with her walker, barely able to walk. We gave her some magnesium, and she came back in 2 weeks. And I'll always remember sitting in the office, waiting with my wife, and this woman just came, racing into the room without her walker, smiling, the biggest smile I ever saw, showing off how wonderful she felt. Magnesium makes us all into heroes. And it makes us also into villains if we forget about it. It's that important, it's that basic to life. We wouldn't treat people who are not breathing unless we're trying to resuscitate them and bring them back. We also don't want to treat people with magnesium deficiencies without addressing these deficiencies. Our patients will sleep better, we'll bring down the inflammation, we increase their ATP production, will help clean out their cells, help nutrition get into the cells, and reduce calcification. These are all very important things. We cover a lot of bases, including tuning up the enzyme activity and hormone production. There is no end to the results that we're going to see just through using magnesium.